Hello everyone. Today on this lecture we discuss about epidemiological study. So what is study? Study is the closely we putting attention on a particular subject, that is called study. So here in epidemiological study, the epidemiologist, or you say the researcher, putting its close attention, or continue watching the disease persons, the individual or the group, as you are the part of community. So we're taking the population or the individual into a close attention and find out the questions of the answer. The questions are what? When, what is the disease, how the disease occur, which are the risk factor, and how to control that. So these are the questions and the answer that can be get by the study. So the researcher already designed two studies, or you say the epidemiological methods, by which we can answer all the questions. So what is epidemiological study? It is the foundation for the disease control and the prevention. We all know that the curative treatment we got in hospital or institutions when we were fallen sick. But we have to find out the preventive and a control. So how the disease, if disease we control the disease or you prevent a disease, so the people will not fall in disease and there no need for any curative treatment. So we have to find out the basic foundation, that is the control and prevention of disease. So how can this possible? By through tracking. So tracking means we surveillance, we putting our attentions, or we continue study on the matter, on to whom we are going to study about the prevalence, or prevalence of the disease, means those who are in case now is already in disease condition or who has undergone the disease conditions. So this population or these individuals are, we are going to thorough, we putting our surveillance, or we are putting the study and characterize the natural history and how the disease cause the changes, or you say the what are the how are the physiological changes that will be takes place inside our body, and the identify the risk factor. So what are the risk factor, or which are the causative agents that make the agent to enter our body and makes the host, or you say the individual, to fall into sick, so or fall into disease condition. So that is all about we discuss in this epidemiological study. So, and there is two design are there. One is the observational and another is the experimental. So observational is names is indicating that here the researcher, or you say the epidemiologist, only observe the patient, if it is an individual or the population, or the population in the community. So one is the observational, and in observational, in the two way, if you are observing about the population, then there is the two way. One is the health survey, another is the ecological study. So health survey, that is the systemic collection of the data of the particular of the population, that is the health survey. And ecological that's derived from the word okios, which means in Greek it means is environment. So environment, what are the effect, what are the factor in the present in environment that makes a healthy person put into disease, that is called an ecological study. So for the population, by the two ways, health survey and ecological study, we can get the descriptive study. But if we are studying about the individual, suppose we are studying about the individual, so here there is a two way, that is one is the descriptive and another way is the analytic. So in descriptive there is the two, that is two in descriptive, that the two way, that's a case report and case series. So descriptive, it is provide the data. Descriptive is provide the data, the distributions and the frequency of the occurrence of disease. So it's provide the data about the distributions and the frequency of disease, that is time, person and the in the place, so where the diseases occur, and which peoples are more affected, and which area the diseases occur. Suppose you are taking as a case as a malaria. So malaria, you know, the malaria is mainly seen in the rainy season. So particularly in rainy season, or you say in the month of September or August and September, so we can find out the cases of or prevalence of or the we found a disease person of malaria. So which area is affected, which not in all area, in particularly which area people are more affected in malaria, and which group of people, so which age group people, or which economical people, or which nutritional level, nutritional status level they are affected. So this is give the disease and the frequency. If I have the data about the disease and the frequency of the disease with time, in reference to time, place, and persons. So that is called descriptive. So it's give descriptive knowledge. So that's name indicated descriptive data. So it can be descriptive study can be texted by two way. One is the case report and case series. Next, another way is there. One is the analysis. So yes, analysis means breaking down. Okay. So in descriptive, what you collect the data. We collect the data of the distribution determinants of the diseases. So we from that descriptive data, the second step that we will go, that is the analytic. So in analytical we obtained a relationship between the variables. So whatever the observe, whatever the data we collect in the descriptive, here we analysis means we obtain a relationship, or you say association of the exposure and the exposure or the outcomes. So and what is the meaning of exposure? So exposure means, suppose we are taking as an example the smoking. Those who the individual who are having the habits of smoking, they will fall in lung cancer. They are getting the disease of lung cancer. So here the exposure is the smoking. So he is in habit, or he was regularly the habit of smoking. So that is the exposure. And what is the result, or what is the outcome? That is the lung cancer. So lung cancer is the outcomes. So in analytic, there are again three ways. One is the cross-sectional, another is the case control, and the third one the cohort study. In the cross-sectional study, here we study the individual in a particular time, in a unit time. So we study, we see number of populations are there, peoples are there, and maximum people nowadays having the habits of smoking. But those who are not following, those who are having the habits of smoking, they are not falling in disease like lung cancer. So, so in a unit time, when the some of the few people who are found in cases who are found in disease condition, that is called a cross sectional study. Okay, so it is the study for a unit time, or a limited time. So that is called the case, that is the cross sectional study. It is also one type of a descriptive study also. In case and control study, there is two groups are there. One is case, another is control. So case, who are case? Those who have already disease like lung cancer, and control, those who don't have the disease of lung cancer. Okay. So in here, two groups, we take two groups, and they have to expose multiple exposure. Means they having the habits of smoking, they have the obesities also, then they have tobacco chewing type of habits also. So their multiple exposures are there, but outcomes, and we see disease in cases, means few of them having the disease, and if though they have the habits of smoking, alcohol, and obesity, but they don't have the disease. Okay, so they are called the control groups. Okay, they have the habits, they have habits of smoking, obesity is the obesity, the status of level, and tobacco chewing also their habits. So they have the multiple exposures, but they are not falling disease, that is a control group. So that study is called case and control study. And another study is the cohort study. So cohorts is the wholesome population. So here we take the people or the groups, individuals, they having the same characteristics, means they having the same age and sex, and same, they have the same nutritional level, they have the same economic level. Otherwise say the same age group people having working in the same environment. Okay, so here the groups are same characteristics, but they have when they are exposed to smoking habits, and they have disease multiple, we find multiple disease, but it is a time durations. In cohort study it will take more durable times of study, then after study we get that come to knowledge about the disease. So they have multiple disease, some might have tuberculosis, some might have lungs cancer, some might have the ARI, acute respiratory infections, so multiple disease, but exposure is one, that is the smoking habits. So in again the cohort study are done in two ways. One is the prospective, forward, and another is the retrospective, that is the backward. In forward we see we are studying the presently. We are presently study a group, but we are fine. But after 3 years, our study says that as their habits of smoking for a same characteristics of people, they may be in future, there may be chances of lungs cancer. So that is a forward study. So that is called prospective study. And another study is that is the retrospective, that is the backward. Here we are in the present, but we back to historical, we go back to the past time. So in past time, whatever the risk factor, whatever the exposure that the persons or the individuals face, and now he was fallen lungs cancer. So it is from the past to present study. So that is called the retrospective. So this is the two way of cohort study. One is the prospective and another retrospective. But it is a durable, it's a long term study, that is in the cohort study. And the last one is, and the second one is the, this is all about the observational study, and then the second one is the experimental study. So the experimental is, other name is interventions. Intervention matlab means we putting some from manipulating, we manipulating within the groups. So in descriptive we know from the descriptive we identify, we cut the data of the risk factor, what are the risk factor that may be caused. In analytic we confirm what is the cause of disease. Now all these things is clear. So in experiment we manipulate. Suppose we know that some of the people may be lungs cancer, so we put them in treatment. Suppose we provide them into treatment, or we supplement their nutrition, and also immunizations if possible, there is any immunizations. So if we were giving immunization, treatment and nutritional supplements, and we found that the prognosis is good, or we found the control groups are more, then that is called an experimental study. So this is the experimental study. Again the two way, randomized and non-randomized. So that is the trial, that is a group trial, and the individual trial that will be take place. So this is all about the epidemiological study. And again one of the important questions that will come in our community, that is what is the difference between the descriptive and analytical study. So in descriptive it's provide the data about the distributions and the frequency in reference to time, place and persons. Okay, so the three possible questions like how, when, whom, where and whom. So these three questions will be come into descriptive study. But in analytic study it conduct to obtain a relationship between the exposure and the outcomes, because already discussed, we already in descriptive we collect the data, and now we are analyzing, we are breaking, we are analyzing, or we break down the things, the data that collected from the descriptive, and and find the relationship or association between the exposure and the outcome. So here how two questions is raised, how and why. These two questions that will be raised in the analytical studies. And another point, identify the population of high risk. So which population, which group of population, which age group of populations, they are risks of disease, higher risks that called. And in analytical study, it does help to identify the cause. We come to know the cause of disease. The what is the causative agent or etiology of the disease. So in descriptive, we all study as a whole, means one group. We are studying about a one group. There is not subgroups are there. But in analytic, there are at least two groups are there. Okay, so in two groups, we make the people or you say individual into two groups and analysis or you study them. Okay, by continuous exposure and what are the outcomes that will be come out. So this is analytical study. And another point, it generates hypothesis. So what is hypothesis? Hypothesis means prediction. Prediction means we are forecasting. So that is a tentative statement. It's a tentative statement or the prediction for the variables. Okay, so this is generate hypothesis, that generate hypothesis. But in analytical, it's able to conduct the test hypothesis. So as we confirm the identify the disease, then we make the two groups and analysis them, but the analysis the exposure and the outcome groups. And here we tested the hypothesis. Now we are concluded. So that is tested the hypothesis. So this is all about the epidemiological study. Hope you understand on this lecture, and thank you for watching, and please subscribe my channel.